This is Larry Nassar, a respected sports doctor who built a career around trust. Athletes, parents, coaches, universities, and an entire system that treated him like the expert in the room. He was even the team doctor of the United States women's national gymnastics team. And for years, he used that badge of doctor as cover to sexually abuse patients, then shrug it off as treatment when anyone got uncomfortable.
This is a jailhouse letter, apparently written by a Jeffrey Epstein. It says J. Epstein, and it was sent to another infamous sex offender. That would be Larry Nassar.
If you've been watching the news recently, you've seen that him and Jeffrey Epstein were very close buddies and have been exchanging letters, and as stated in one of the letters, both shared love and caring for young ladies.
And when I was 14 years old, I tore my hamstring in my right leg. This was when he started performing the procedure that we are all now familiar with.
The Department of Justice followed with a statement claiming the letter is a fake one. But there have been many contradictions in that department with anything related to Jeffrey Epstein. Anyway, moving on with the story. Larry Nassar was brought 2 times for questioning. In August 2014, Michigan State University Police brought Nassar in after a graduate student reported that he sexually assaulted her during an appointment. He didn't come in panicked. He came in prepared. According to the records obtained later through FOIA, he leaned on the same shield over and over. Medical procedure. Misunderstanding. She's confused. That first interview ran more than 2 hours, and even though MSU Police wanted charges, the Ingham County prosecutor declined at the time. This is the interrogation.
So I'm Billy O'Brien. I'm a lieutenant back in our detective bureau. Obviously, it's been told to you that I was going to contact you.
Someone was. I didn't know who or what, but I thank goodness because I couldn't imagine that I was waiting. You know, it's like
right.
Somebody call.
Okay.
You know what I mean?
I guess you come in here voluntarily
Right.
because this is under investigation.
Right.
So obviously, I need to find out from you,
Right.
from your perception, your side of things, what happened.
Right, exactly.
I've got to record it in here
Oh,
just
that's
because
fine.
that's what we do for interviews. So
Right.
just so you know, it is
Understood.
recorded.
Right.
But we do that for most people that we bring in here.
Right.
At any time you feel you want to get the heck out of here, you can get out, walk out. My feelings won't be hurt. Okay.
Okay.
So I guess what I'm looking for is first, do you have a driver's license? Just to fully identify you.
Oh, yeah.
I recognize you by face, but
No worries. Do you need to take it out?
thank you.
Do you need my faculty card?
Nope, that's okay. And this is your current address still? And then, do you have a cell phone that you prefer to be contacted
Yeah.
as opposed to me? When I called the house, I didn't say where I was from.
Oh, that's my wife's phone. So
Okay, all right.
That's totally fine.
I didn't know, so I just,
Yeah. If I phone, if no one's there, my cell is.
all right. And then I had sent you an email too, which you obviously can disregard.
Oh,
So,
okay. I'm not good at emails.
no, that's all right.
You
Sometimes
know, yeah.
some people are, and sometimes
Yeah.
some people aren't.
Yeah.
So the reason for the delay in me contacting you is because obviously you know the mandatory reporting protocols on campus. No?
No.
Okay. So basically what happens is that it sounds like there was a complaint made over at MSU Sports Medicine,
Right.
which triggers some mandatory reporting protocols.
Right.
So what happens is the Office for Inclusion is a mandatory reporter here to the police department.
Okay.
So they contacted me,
Okay.
at which time I had to wait for the person who was going to file the report to get back into town because they were out of town.
Oh, okay.
So I was able to meet with her today,
Okay.
which is why the delay, so I apologize
Okay,
for
no
that.
worries. Okay.
So obviously a little bit stressful for you
Just
because
wondering why.
you're wondering.
Right.
And so what I also do is I ask Office for Inclusion to kind of hold off, so to speak, because I like to put any type of police investigation in front of an administrative investigation. But
Right.
obviously you probably feel the other is more important because it's
Well,
affecting your employment.
everything. Well, it's affecting her. That's my,
Right.
It's like I want to make sure that this gets resolved so that there's better understanding.
You can tell from Nassar's body language from the start that he is very confident in himself and that he can secure his way out of this.
But it's medical. That's the problem. Like, how did she not?
So those would be some of the things we work through, right? So
Correct.
what may be helpful is if we start off with the videos.
Yeah.
That way you can show me, and then that way, and then what I'll probably have you do, if you don't mind, if they're not too long, and you can email them to me,
Oh, I got Dropbox.
Oh, perfect.
Yeah. I made a Dropbox
Perfect.
for the dean. You know what I mean? I can't get on.
Yeah, you know.
But I can send you. You can send me an email.
Yep, I sent you an email.
I can send you the link to the Dropbox.
Yep, that'd be perfect.
Okay.
Yeah, they normally have our wireless pretty well locked down here.
Oh,
so.
yeah. No, I can send it to you when I get home. It'll be under sports medicine. I have it in so many different areas because this is my Australia. Okay, so this is what I was down in Australia doing the lecture, and it looks like I put a few in here. So this is what probably it looks like would be on the Dropbox, the majority of it. So let's go back in time. Okay, so this was like my first video that I ever made of this. It was made on a VHS tape.
Oh,
okay?
Lord, yeah, we're going way back.
Yeah, okay. Okay, so her parents are in the room, you know, and I wanted to give this lecture. So she volunteered. It's the first time I ever met her. Okay, and she had see her chest movement, you know. So that's her range of motion right now. Okay, so this is what I do. So she had physical therapy, 6 months of physical therapy. Okay, she'd been resting, you know, and they're like, okay, let's go see this doctor in Lansing. They came. Okay. So I'm doing the palpation of this part, but let me just go forward here. But you can see where my hand is going here now, but that's nothing compared to what I'll show you. That's her strength there, and okay, but right. Let me do this here. So I tested in different areas. So now she has pain there from this, but. So okay, so now I'm doing one of her leg treatment, okay. Go. Anyways, and then I work her up. I gotta keep going. This is just the video of it.
No, that's okay.
So now look at the range of motion just from that. Okay, remember the range of motion was here.
Yeah.
Okay, and then I worked the fascia up the rest of her back. Okay, so she came in with a hamstring problem. Okay, but so where am I working? You see what I'm saying? I always tell people it's like from your ponytail to your big toe. Okay. Now for 6 months, and now look at this range of motion. One treatment. Okay, and that's where she couldn't get for 6 months. Okay. You start doing this, and it's without even stretching her. Okay. The voice is off, you know.
No, that's okay.
You know, but so you can see that it basically doubled her range of motion without even starting. Now I'm starting to do a little bit of stretch, and that's the end point. You can tell when her body language is, you know. So that was like, okay, back then I was thinking I was treating like the operator internist. I was trying to figure it out. Okay, the way that I first started working in this area was a gymnast had a hamstring problem and said they weren't getting better, same type of situation, and she was guiding me. And she was like taking my hand, and I'm right in her vaginal area, and she said, that's it. And all of a sudden, with my hand there, her range of motion doubled. You know, I'm like, what the frick did I just do? And so I did all this research, and that's how I became known for this, because I did all this research to try and figure it out. And I met with Dr. Greenman, who was he's passed away now, but he wrote the book on osteopathic manual medicine, principles of manual medicine. And he's like, I think you're doing more sacral tuberous and pelvic floor as opposed to operator internist, you know. So anyways, so that's why this is like, okay, that was the beginning. You can see how long ago that is.
Yeah.
So, you know, and this is what I made for the lecture. And I do these videos all the time and send them to, like, everyone leaves instead of paper, they leave a video on their phone.
Okay.
Okay, like if I wanted to go see a therapist or a doctor in a different area. So these people came up from, here we go. So this is in my lecture that I give now. You can see this is in our new office and everything.
Lotion, and this is for the myofascial release.
Better quality, obviously,
She
because.
does not have very good external rotation. She's got so with that hip like that, I don't want to twerk her.
Now her parents are in the room, you know, for this too, of course. I think her mom actually is holding the camera.
Right where the ischial tuberosity.
I'm trying to show it out. You can't really see it on the skeleton there because, like I said, they were holding the camera, not.
So I'm trying to avoid that.
But then here.
We're coming up right through here with my counter pressure. Over just unplug it a second. Like this. Here, just unplug the cord. There you go. Yeah, it should be fine. Come on over. I want you to actually see so Jamie can see.
Okay.
Okay, so now, here is like where the leotard line would be if she's wearing a leotard. She's got a little tape. She's been taping her sacrotuberous ligament with
It's one of the things I invented with that tape job, too.
Now here's your tuberosity. You're sore right here, correct? Okay? So I'm going to come more towards the rectum. Any pain?
No.
Okay, so it doesn't hurt there when I push. I'm pushing at about a 45-degree angle. That's where I'm going to put my pressure. And maybe up towards the tailbone a little bit more as I come up. But this is my hand placement. Sometimes my hand has to be actually down here, or I come across, so I'm on the pubic symphysis.
Okay.
And my hand supporting the pubic symphysis in the front.
In the front.
Yeah.
Okay. I mean, yeah, I'm touching her areas. You know what I mean? That's reality. You know what I mean? That's.
Sometimes I actually have to grab right here to apply that treatment process. Okay. So now I'm going to have you guys come back over here, just so they can see where.
Okay, so that is now what that's showing like hand placement. But what you can do with that, here's like IT band, pelvic floor. Let me go up to here's like ribs. I think.
Okay, ready? So now we're going to work
just update it again.
Outside up because she has that butt head connection where she had the pain when she flexed her neck. So I'm going to check her here now.
So my other hand you can't see, but it's in the inner rectovaginal area.
So working half of the spine. Ligament.
Oh wait, okay, this would be testing her. Okay, so listen to what she's saying.
Now, again, I'm going to bring her leg slightly out.
She's saying it now.
Push on the tush. I'm going to bring her leg slightly out.
Go back further.
Okay, now, again, I'm going to bring her leg slightly out.
Go back further.
Okay.
This
Yep. So her
pain.
paraspinal.
This is what I want to hear you say.
Yep.
Pain,
So
yes,
her
pain, yes.
paraspinal
Did you hear that? Just
Mhm.
briefly. That's what I'm doing up. So where's her pain? Is there pain? Is there pain? Is there pain? She had pain the whole way up. Okay. And now I put my hand.
To the ischial rectal fossa or the sacrotuberous ligament.
No.
So the pain goes away.
Okay. You see what I'm saying?
All the way up. Just by putting pressure on the sacrotuberous ligament. Now, her paraspinal muscles have relaxed. What I'm treating.
And that's what I've been doing with her. Is like, does it hurt now? Does it hurt now? And I
Okay.
changed from those different hand positions. Pain doesn't hurt? Okay. You know, so I'll take a deep breath, you know, and then I hold it and work it out. You know, so that's what I'm getting at. Is like, I get her in a position that doesn't hurt. You know, the pain's going away. And I'm talking the whole time. That's when I'm like, if I put her in a position that made the pain go away, and my hand is down there, there's no question about it.
Right, obviously I can see that.
You know, why?
So after this, we'll roll her over and check her.
But it's a conversation too. You know what I mean? Number one, number two, you know, which feels better. And then I do this because I treat them seated, standing. So like here is even.
All I want to do is put her hands back behind her like this.
She's doing the slump test.
Now if we do both here, it goes away, right? Okay,
Pain.
put your head back down.
Pain
Head
comes
comes
back.
Punch
Okay.
the foot, pain goes away. That shows you how the fascia between above and below. Okay, so what this tells me is that she needs to be fascially released from
But now
the
the.
so when you're more on the figure. I'll say down, say down as you're walking. Okay. She's got a stabilized side joint. You shorten your stride,
Throw the
shorten,
head in here.
and you long exit the
I'm
stretch.
not gonna do it
That's
right now.
joint. So that needs to be mobile. Just let
There.
it
Okay, now watch.
hold to the side. Sacrotuberous ligament, you
Okay.
rise and applying pressure this way. So I'm pulling out. So my hand's here, okay? She's sitting and I'm pulling this way.
So she's going to be sitting on my hand. I didn't do this with her, but I'm just showing you that, you know, I do this in so many different positions. I do it standing too, okay? So now, she's legit sitting on my hand, okay? Coming up, you know, so you know bone to sit bone.
Yeah.
So my fingers are on the inside of that, between the two sit bones, pulling this way, okay? Change my position. and the pain's gone, because I have to change the,
Total flexion.
okay, so that was painful, putting my hand there, changing it because of different vectors, forces is. So it takes the pain away, you know, then okay, that tells me, okay, I need to do this, you know what I mean, so, and then I actually send them home with exercises.
That's what I was going to ask, so then what is...
She sits on her hand and she does some exercises, so let's, so, and then standing, do I have the one in here? No, I bet you that's just in the actual, this is like Botsford. I mean, I've done this lecture so many times. Let's just do Botsford. Is that, yeah, let's see if Botsford shows us the whatchamacallit one. Hello.
And then, so then do you tailor the exercises they need to do depending on positionally where...
I have one patient asked to come in, and she comes up, and it's hers both sides, so she has to take both hands and push up, and it's the only, she's had pain for a year, okay, and since I've been showing her how to do it, she goes home, does it, and she's treating herself, and she's back to doing gymnastics now. But it's because of all these nerves that pass through here too. Anyway, so this is, oh no, this is an older, the videos aren't connected. Go away. Sometimes when you convert them, I don't want, how about this one? I've been, you know, updating them, you know, and now it's like a PDF. This just shows the patterning of how through this ligament you go up and you affect the ribs, latissimus dorsi. This is all from where I found the research was in with Fleming. He did a lot of research on pregnant ladies. Okay, and so I used to joke that, you know, I took what they do on pregnant ladies and converted it to my athletes, because I work with gymnasts, dancers, and figure skaters. That's like 80%, 90% of all my patients. They're all hyperflexible.
Right. What
happens when you're pregnant? Relaxin comes out in your pelvis, and you get all these problems because of the pelvis relaxing to make room. So it's like, okay, you know, that was, so the research that was done on pregnant ladies, you know, with, okay, following this all stuff, that's what Fleming's, it's in this textbook called Movement Stability and Low Back Pain, okay? And so we're trying to create stability. So it'll morph, it'll make sense to you as I go through it. But anyways, these are from his textbook.
Nassar didn't show up empty-handed. He brought a laptop and tried to show the investigator videos of him performing similar treatments to convince police it was all legitimate. New outlets later reported that he'd even gotten wind of the complaint from a colleague before the interview, so he came in prepared.
Go ahead. I can look while you're talking more, you know.
So when Dr. Kogan initially talked to you about this, so it seems like there was a you know, some time that went by from when he initially talked to you to when you were talked to again. Mm-hmm. When he initially talked to you and you guys had your conversation, what was the resolution or outcome of that conversation? So he tells you, hey, you know, she comes in here.
Right. I wasn't that worried about it. I mean, at that point, because he had said he explained it to her, and she didn't want to make a big deal of it. Was his words.
Okay.
You know what I mean? But he said he had to move it up the chain. You know
and that he explained the procedure to her when you say he explained it to her?
He explained it to her. I can't talk for him.
No, I'm just curious if he told you.
That's what he said, is that I tried to explain to her what you do. You know what I mean? And so those were his words, you know what I mean, or paraphrasing, because I can't remember what
no, that's okay.
You know, and she didn't want to make a big deal of it. And so those are the three things was that I remember from our conversation or four things was, it was after the Instagram picture and the moving of the underwear and moving of her breast, and because I was treating her ribs area, and then that she didn't want to make a big deal of it, but she thought she needed to talk to Jeff about it, and then Jeff saying that, you know, appreciate what you're telling me, so I will move this up the chain.
Okay.
Okay, so that was like the...
So then it was just kind of left open-ended for him to follow back up with you?
Nothing else that happened. There was no conversation until Friday.
Okay.
Okay, it was just so I figured, okay, nothing ever happened, you know what I mean, like, you know, then once it did actually then make it up the chain, and the dean called in Jeff Friday morning, that's when it's like, okay, so obviously she's making more of a deal of it, you know what I mean, than not wanting to make a big deal of it. And I said, and I told Jeff at that time, I said, if she felt that way, I would encourage her to say things. You know, if she were to talk to me, you know, to say that some doctor did something, I said, you need to discuss this. You know what I mean? Because that's what I am, more of the patient advocate than anything else. It's my role. That's me. I don't know how else to say it. It's like me. You know,
right. Everyone has their own style.
Yeah. Well, it's not just style. It's you. You know what I mean? As a person, to be able to do this stuff, and to be able to do this stuff for so long, If you don't have patient confidence and patient trust, you would have been having my ass in here how many times?
Right.
Okay, especially when I'm doing this on 10-year-olds, 12-year-olds, okay, with their parents there. But I'm obviously doing a doggone good job explaining things, okay, because what? You know
Yes,
what I mean?
that was going to be one of my questions, obviously. So there's never been any complaints that you're aware of prior to this one? And obviously you're videotaping things here, you're doing
Right.
lectures on it.
Well, this has been going on for forever. You know what I mean? Like, not forever, but the videos, you can see I've been videoing and changing and adapting. So I keep, so that it's transforming, you know, from being just the operator intern to sacrotuberous to pelvic floor, you know what I mean? So all of that is the fulmination, the end point. I guess I can't find it.
No, that's okay. Don't worry about it.
But you want to see the ones with the, and listen to the words that I'm saying too, okay? And just watch my body movements, okay? When I'm checking things, you know, when my hands are on the patient, please watch, because I could see how she's massaging my breast. No, I'm like, how's that there now? How's that there? You'll see my hands move, okay? It's talking with my hands. It's how's that feel there now? It's like I tell people, you don't want to use left, right, or to your left, or you move it so they know what you're talking about. They can sense movement, right? So if I try to describe how does my left hand feel next to your right, you know, no.
Right.
But if I go like this, you know what I'm talking about, okay? So it's the way that I communicate because your hands are on them. Okay?
So that is exactly what we're talking about. So was there more details given to you on Friday then? Did they go over, because you said, hey, you know, they came back.
On Friday, what the dean said was that it's been moved up the chain and that this could become a police issue, or it's, you know, that it could become a police issue if she chooses to file a police report or whatever, you know, and that because of that, it'd be in your best interest, in our best interest, if we don't have you see patients right now, because
which makes sense, like you said.
Well, yeah, and I'm like, sure. He goes, you know, so you take the time that we need. You know, I said you could do the research, do the academic, you know, work that I'm doing. You know, so I said that's exactly. You know what I mean? So I'm not even going to the high school. You know, I go to I'm Holt High School's team doctor. I'm the team doctor at Twist Stars. You know what I mean? So it's like, okay, you know. So I guess that's where I'm getting at is, what communication did I miss that she was trying to tell me? Okay, did she say anything about verbalizing that I feel uncomfortable or anything like that? Because if she did, I didn't hear it.
So those are some of the things that I'll go over with you. I can go over in very fine detail into what she said. So I'm not going to hide anything from you. There's not going to be any secrets. I'll go over all that stuff with you.
Okay.
I just wanted to know kind of what you knew up front, and then obviously I wanted to see the videos, because what I'm seeing in these videos is basically very similar to what she is telling me happened.
That's what I do.
Yep. So that is why I wanted to see those first, to say, okay, are we on the same page? Are we talking about the same thing from the get-go? Which we are talking about the same thing. I've seen those. So it'll be very important for me to get those videos, and especially the ones, if you have ones in more detail, like you said, are a little more graphic.
To the whatchamacallit, to Romania.
Okay.
You know, so those were just done for 2013 European, so last summer.
Okay.
So getting ready for the 2013 European Championships, and was having a problem, and so they contacted me to say, hey, you know, what can you do to help? I mean, England, Canada, Germany. I mean, they.
Right.
This is what I do. Okay, I'm not saying that yes, I'm there, and yes, it's medical. It's not, I don't know how else to say it, but I'm totally taken by surprise, but at the same time, feel like crap that someone would feel that I was doing something inappropriate to them. Because this is how I make my living. This is what I do. I've helped scores of people by doing these personal issues.
Which is good to hear. It's, you know, it's good to hear that you feel bad that she feels that way.
Yeah, because I feel like this little deviant, you know what I mean? And that's not right. And that's not... Okay? I mean, that's reality. Okay? That's who I am. Okay? That's why I'm like, of all the freaking people, I'm the only guy even allowed in with the national team. Okay? It's all our females. Okay? But because of who I am, it's the trust. If I did something wrong, do you know how quickly that would spread like wildfire across, I mean,
Right.
It's my 27th year with the team, you know what I mean, or whatever, since 1986. I've been with the national team, and I'm telling you, those kids, it would go boom, chuck, boom, chuck, boom, chuck, chuck. You know what I mean? Like, no question about it, okay? And that's what I'm saying is that there has to be a way that a person's able to disconnect, okay? If you don't disconnect, then you're screwed. You know what I mean? You got to be able to disconnect, because that's what I'm saying is that when you're in that area, you have to be palpating, you have to be doing therapeutic touch, not any other touch, because that sensations can be relayed through your hands. Persons can tell. You know what I mean? And it's like, how did I miss that signal that she felt that I was doing it inappropriately? Was I really that off that day or what? You know, that's my issue. And it's hard because it was so long ago, you know what I mean? But it's what I do all the time. So was I tired that night? I'm like, okay, did I get to sleep that night? Did I, you know what I mean? I'm just trying to figure out, was I off? Was I sick? I wasn't sick, you know what I mean? I only get 5 hours of sleep usually a night anyways, you know, but that's normal. Like, did I get less than that night? You know, what made me out of sync? What made me not be able to recognize that I was making a patient uncomfortable, okay?
So generally, do they verbalize that, or a combination thereof?
There has been a few times where that has been brought up, okay? And each and every time there was sexual abuse.
Okay.
So that's what I'm saying is when they're uncomfortable like that, there's been 3 cases, and all 3 of them were sexually abused. Okay, so that's why I'm like, yeah. Okay, that's why I'm like, okay, is there something more? What am I missing? Because that's what I'm thinking all the time. Okay, if someone's tensing up or having an issue with this, my first inclination is, were they ever sexually abused? Okay, so that's what I've had conversations with people about, you know what I mean? And now I'm the one on the other, that's what I'm saying, is I'm the one on the other side of the table now, you know?
Right.
So I'm like, how did I, if for God help me, she's never been, you know, sexually abused, but say if she was, that's my job. Why would I miss that? Because then it's my job to bring help to that. You see what I'm saying? So where am I losing it that if she, God forbid, had been, that I would have missed that cue? Because then it's like, okay, boom, chaka, boom, whole another period of like, it's time to have some psychiatric intervention.
Right.
You know what I mean? So that's why I'm like, 3 times. Okay? And so that's, though there's been other than that, and each one of them were in the past sexually abused. You know, and so, but I'm the one who brings it up.
Right.
Okay?
Right.
You know, she's way uncomfortable for what I'm doing. You know, without them even having to verbalize. Okay? Because
obviously you can feel a change in their body.
Okay, it's like, that's not right.
Police had the patient's account, and they pressed Nassar for his version. Nassar's core defense was basically, it's a medical technique. She misunderstood. He described it as a legitimate manipulation connected to the pelvic floor/ligament area, and acted like this was normal in his practice. He tries to explain why he didn't notice she was uncomfortable. He says he works with sensitive treatment all the time, even with minors, with parents present, so he expects to read people's reactions. He insists she never complained and even seemed to say she felt better.
Okay.
So I just was waiting since Friday when I heard that it did go forward to have this conversation, because I don't want her to mentally be going through what someone would be going through when they think that they've been sexually violated. Okay? That's the problem that I'm facing, is that it's a dichotomy for me. It's like, I'm the person that usually puts the arm around them, not the one who's you know, doing the wrong thing. That's the dichotomy that I'm stuck in.
And you're right. So that's what she filed the report for. So right now what the report is titled, just so you know, is a sexual assault.
Right.
Because that is, like you said, that is how she's feeling. That is what she thinks happened. That's her perception of things. So there's a couple different times that she's feeling that you sexually assaulted her throughout the examination.
Okay.
She did say everything that you were telling me is along what she said. Hey, it was a lengthy examination, went to these exercises, you were working on basically her whole entire body. So, everything you're walking me through over here and you're showing me is everything that she was telling me. What she is saying, and you use the words, the same words she used, that she's saying that. And then she said that she felt like that you were massaging her breast and that was not part of the manipulation that you were doing. So that'd be the first piece. So if you want to talk about that first piece as what it is you were doing.
When you're working ribs, if you can't use the arm, if your shoulder, it's like, the muscle energy part, I'll crack a back. So we crack a back, crack a neck, the usual stuff, and then we try and do push against me, and then you do stretches. So when I'm doing stretches, you're on the.
And again, if you have videos of that too, that would be helpful.
Let me show you here.
Not that you necessarily have videos of everything, but.
I teach the ribs. I gotta find where I'm at. Sorry. Videos transfer. I go back to transfer. Not a lot of people like to treat the ribs, and because I work with the crew athletes, I treat a lot of ribs because the crew athletes, have rib issues, obviously. But that's what I mean. So that's another area that I do a ton of lecturing on because I treat it a lot. I'm in the wrong. I gotta go to. I took stuff off my computer was getting too big, so that's why I got the external hard drive going. Let's go to the external hard drive. Go up to lectures and articles. OMM. Stop. Lots of lectures. All right. OMM ATC, for example. Ribs ATC rough copy. Let's see if that's. So this is Dr. Greenman, like I was talking about. So you can see his hand placements. So what I tell people is when you're working on the ribs, I don't like to stand on the side. I do it sideline. When I do it, I'll be at their head or I do it sideline. And I tell people, don't come in this way. That's offensive. Come in this way. If you come in over their head, that's offensive. You know what I mean? It's just the way that I talk about it. So I actually come off from the side. And then I'll turn their head and do some work that way with it. But that to me is a lot. When you come at someone this way, that's more offensive.
Seems assaultive.
Exactly. And that's why I'm like, I lecture to people about how you try and not, you come across from the sides, and then when you sideline them, you can do it sideline sitting, like showing prone. But it's the rib cage. You know what I mean? You're going to be on the chest wall. You move the breast down. You move the breast down to get down to the wall. It's like giving someone a mammogram almost. And when you do the myofascial, let me see if I've got the. Oh, don't save.
So while you're doing this, are you explaining? I mean,
I always do. Because I have to know if it's making them feel better. That's why I'm like, is that bad? Because if that doesn't work, I'm going to change my hand position. If that doesn't work, it has to be a conversation. I'm not omnipotent. You know what I mean? It's like, and that's why I'm like, I don't understand why she just didn't say, I don't understand what you're doing. Or anything along those lines. It's like, really?
So she did say, while you were working on her, that you did say, does this feel better?
Yes.
And that you were going on with that. What her perception is that you weren't explaining what you were going to do beforehand, so she didn't know what was coming.
Uh-huh.
But that she was very well aware that while you were doing that, you were saying, how does this feel? Does this feel better? And that she was answering,
Right.
either yes or no.
No, right.
So again.
Because I can't remember, but I do this on all my patients. If you do the same thing every time,
Right. Yeah.
you know what I mean, then I'm like, okay, if I was treating
In
this...
police work, we have to do the same thing, do it the same way every time.
And
that
then
we
you don't screw up, you know what I mean? So that's why I'm like, so where did she... I don't know if you can tell me that, but did she ever say anything to me?
Yes, I can tell you everything. I
Yeah,
have no
yeah.
problem telling you
Did she
everything.
say something like, I feel offended, or what are you doing, or can you explain it to me better, and I blew her off?
So what she's saying is that while you were, what she said in her words is massaging her breast, what she said is that at some point she tells you, okay, you don't need to work on my shoulder anymore.
Okay.
I don't need to work on my shoulder. It
Okay.
had like longer term issues and I
Okay.
need more work than that. Do you
Okay.
remember that at all?
I don't remember, honestly.
Okay.
But so did I stop working on her shoulder, or what did I do?
Yes.
Okay, so she said stop working on her shoulder, I stopped working on her shoulder, okay.
Yeah.
So I didn't do anything against her wishes. I mean, right, she said to stop, I stopped, okay.
So what
So-
she feels, and again, this is her perception and what she
Okay.
feels, and you're showing me videos, you're explaining everything
Right.
too, which makes sense what I'm seeing here
Right.
too. What she's saying is that, initially your hand was up kind of on
Right.
her top shoulder area and
Right.
slightly on the top of her breast,
Right.
and then moved down
To
again,
the
like
wrist. Right.
to, and what she calls is like a full frontal on top of her breast, and that you were massaging her breast. So,
Okay, go
Nope.
ahead. It's okay, I understand her perception.
Yeah, and so-
You can obviously see how she could feel that way. And when we do myofascial, too, you are having her breathe, take a deep breath, exhale, and you're doing that, okay? I mean, as they're breathing, you're doing that motion to try and stretch the fascia, okay? Go ahead, I'm sorry.
no, you're perfectly fine. It's good for you to talk a lot, right? Because then it's more for me to know. So I'm not going to stop you from talking. I prefer you talk more than less. So you're not going to hurt my feelings.
Right.
So what her perception is that she didn't know that was going to be done,
Okay.
but that there was the communication throughout that,
Okay.
that, hey, how does this feel? Does
Right.
this feel better? Does this not feel better? And then she said she got to a point where she felt uncomfortable and she thought that it was inappropriate,
Okay.
and went to the line of being from a medical manipulation
okay.
to being inappropriate, at which time that she had said, hey, I think you've worked on my shoulder enough. I don't
Okay.
need you to work on my shoulder enough.
Okay.
And again, I know you see a lot of patients. I just don't know if, you remember anything specific to that or her
That's what
saying
I'm saying.
that.
That's what I was wondering. But at least I would do if someone says, okay, I think you've done enough. I stop.
Right, which is what she said you did.
Right. So okay, go ahead. Go ahead.
So that's the first piece of it.
Uh-huh.
Then she says in the first video that you show me where she's flat on her stomach.
Right.
And then what she says, again, just like you're showing me and you're explaining
Right.
to me, is that your hand had went in between her butt cheeks.
Right.
And then she said the head went more towards her vagina and the vagina hole.
Well, not.
That's the way she's
Okay.
explaining it to me. So,
Okay.
and again, I'm not using medical terms, I'm using her
That's
terms,
okay.
right?
That's okay.
So what she says that your fingers went by her vagina hole,
Right.
and that she felt again that was a massaging
Right. Okay.
nature, and that she felt that had went on for too long, and that you hadn't explained it to her prior to you doing it. So it was unexpected to her that she didn't know that was coming. And then when you were doing it, that she felt like it was not.
Was I talking to her during the time though, like I normally
So
do?
she says, yes, again, that how does this feel? Does
Right,
this feel better?
right.
And she says that initially she says, yes, it
Yes.
does feel better. So you continue.
Right.
And then she says that at some point that she says that she felt that it was hurting. So she says, hey, that hurts. Can you stop? And then you stopped at that time again.
Okay. That's what I'm saying. It's an interaction, and I don't know how to say this, but that would be appropriate. It's like, you're working on them, and you're trying to trying to do the work. You need that feedback from the patient. And I'm getting the feedback, and I'm
Right.
responsive to the feedback, and I'm talking my way through it, as she said I was. You know what I mean? And so, I might have, I haven't been on the records, but that was my second, third, I don't know, I had seen her before, I know that.
Okay.
So that it might be in the note from before that I explained to her. Okay, so if you check the notes.
The detective is not really pressing Nassar here. It seems that she made up her mind even before the interrogation and the videos, where Nassar explains the procedures caught her off guard. Nassar, adding to the fact that the girl was there multiple times before the incident, also takes a bit of the heat from him.
If you check the notes, okay, and see, you know what I mean, if there is a, okay, check the notes and see, you know what I mean, if it's, well, maybe, because sometimes I'll do that, if it's a repeat patient, I don't explain it all over again, because I explained it the first time, you know what I mean, so that's what I'm saying.
So had you done this type of...
I don't know if I did it on her the first time or not, okay? What I'm saying is that if that was in my treatment plan, you know what I mean, like, okay, this is what we're going to do when you come in, you know, this is the process or whatever. I might have explained it to her the first visit, now make the appointment and come in, you know what I mean, and we'll do the work the second time. So it might have been like, you know, when you, okay, the first time's an initial eval, I might like, okay, this is where I probably will go with this, and I would have explained things in the first visit about what we're going to do the next visit. Okay, so that's when it's a follow-up. I usually don't explain as much because I think I explained a lot and I just get to work and I talk through it. So that would be part of the documented medical record. Okay.
How, your office, how would she go about signing release to get those medical records to turn over to me, or how would that, is that how you get your normal procedures over there?
Yeah, it's the release because of HIPAA.
Yeah, right. Obviously, I would need a search warrant for that stuff.
Right.
If
she
were to
copies of the records. You know.
Okay.
Yeah, and so you know, and then because I don't want to be on there. You know what I mean? So you know, whatever's there is there. Okay, so whatever. Okay, so that's what I'm saying is that it would have been if I explain stuff. A lot of times I'll explain it in the first visit. Okay, but from now on, I'll tell you what, this whole thing is getting changed because I cannot have anyone leave feeling that way again. You know what I mean? That's the bottom line. You know what I mean? So
right, which is why you're here today, obviously.
Exactly, because there's no way. So, I mean, lots of things have to change to protect myself from having that, you know, happen again. You know what I mean? And also the patient from feeling that way. But it's like, okay, you know, what can we do, you know, da-da-da-da-da-da. So it's like I've already been talking with Dr. Kovan and Dr. Dietzel, you know, like, okay, you know, we need to do this, we need to do that. We're talking about policy changes, you know what I mean, so that, because we all go in the rooms by ourselves. You know, my wife is at the Alliance, you know what I mean? And she says she gets sometimes her exam done with just the doctor in the room. You know,
so that can be one of my questions, because she had said that there was a resident in the room for
usually
a fair amount.
Medical students, or right, that or a fellow. You know, there's a bunch of people that rotate through.
Okay, so then does the resident, and again, just because I don't know your guys' procedure,
right.
Does the resident normally stay in the room the whole time, or they come and go?
It depends on when the next, because they usually go in first. You know what I mean? So I don't know if the resident went in first on that. It's been a while, but the resident will usually start, report, you know, or it depends on where we are. Like if I go in the room with the resident, then I'll go through stuff, and then if the next patient comes, I send the resident to the next patient, because that's part of it. They have to do an eval and then report to you what they saw and all that stuff, you know. So then if I will be in the room, either the resident goes in first and I join the resident, and then we work, and then the resident, if the next patient comes, the resident can go to the next room, you know, so that we keep the traffic flow going. So that would be the process of normal routine. It would be because I only have 2 rooms, and if I hear the patient gets put in the room next to us, I'm like, go check if the patient's ready, go start seeing the patient, you know, and it depends on where that resident is, because the residents learn. I teach some of the residents, if they're DOs that do manual medicine, some of these techniques, like put your hand here, do that, you know what I mean? And then I say, okay, you know, go to the next room. If you're ready, you can, you know, so it's like see one, do one, teach one type deal. You know? So, you know, it depends on which resident it is, you know, as to where they are in the rotation and training. But yeah, the resident could have actually done some of this.
So do you remember in this specific incident, like when the resident left, or was it in there?
I don't remember, you know, but if there was a resident, that would be and Dr. Kovan actually, not just said that, Dr. Kovan did bring up that the resident left, that there was a resident, the resident left the room. Okay, so if the resident left the room, it was to go see another patient. Okay, but that would have been the only reason why the resident would have left the room, was to let a new patient come in. You know, so that's again, that would make sense because that's what I always do. That's a standard procedure.
Okay, so obviously that's one of her concerns too, is that, you know, she felt comfortable while the resident was in there, because obviously there's two people in there. The resident was a female at the time. And then she said that when this occurred, the resident was no longer in the room, and she didn't know, obviously, you know, what the intention of that was, because then that's when these manipulations were taking place.
Yeah, so it depends on when that resident was in their rotation. Okay, so that's what I'm saying is a lot of times I will, if they're DOs and they've got a menu medicine hint, they'll actually, or tint, whatever, desire, you know, they'll learn this stuff.
Okay.
You know, like, put your hand here, do this, you know what I mean? And so, and I don't know if that resident was one of those, because if it's an MD resident, they don't have a...
Do you know who the resident was for that one? Do you have a specific resident assigned to you, or residents assigned to you?
We have residents, well, they rotate through on, if they're a medical student, I don't even know if it's a resident, you know what I mean?
Okay.
A medical student.
All right.
Okay, so, but that's normal for a lot of us, you know what I mean? Like, they go in and see a patient, so they're in the room by themselves with the patients. That's just the way it is.
Would Dr. Colvin, or who, do you know who would have that information as to which resident was with you that day?
Vicki Curley, our office manager,
Okay.
would be able to figure that out, I think. You know what I mean? Because there should be a rotation graph or whatever.
Okay.
So Vicki Curley, our office manager, would know that. You know. So do you want me to try and get that information to you?
I can call.
Okay.
Just because obviously I'm going to want to talk to the
Residents or whatever,
yeah,
right.
because obviously they were in a room. It sounds like for almost. I'll even go as far as like 3/4 of the examination time.
Right.
So I obviously want to talk to that
Right.
resident to find out, hey, what did you observe during the 3/4 of the time that you're in the room? When did you leave the room?
Right.
And how did you come about leaving the room? Things like that.
Right. I would have been to have seen another patient.
Okay.
So unless it was the end of the day and they had to leave, but that's rare.
Okay.
It would have been to see the next patient.
Okay. And so then you were trying to schedule a follow-up appointment with her. And
Normally I say when I do this, it's like, okay, if they respond well, I'm like, okay, we'll do once a week for like 3 weeks, and then you're usually, it's like once a week for 3 weeks, and then then usually I tell people, you're like 80 to 90% better, we'll spread it out, we'll put an appointment out there for a month after that or whatever, you know, to see if you can hold the treatment, you know what I mean? But it's usually like initial appointment, then once a week for 3 weeks, if this stuff works, you know what I mean? So the manipulations. And so if it hadn't, if there was no benefit from the treatment, she'd have been off. I wouldn't have even had, I would like, okay, you know, you didn't benefit from it, I'm not going to do it again, you know, type deal. Because you see the effect, you know what I mean? It's like, and obviously she must have, like she said, at first it was feeling better, you know what I mean? But then she's, processed it, like, wait a second, okay, so then obviously she felt violated, you know what I mean? But the feedback that I was getting was, okay, she's getting better, you know, that's the way that I was, the communication, reciprocation, that's what I was feeling, okay? So that's the confusion, I guess, that I'm having is where did I not sense any bodily changes, you know, because obviously she said, okay, you know, that's good or whatever, and I was done, you know what I mean? So there was no other mannerisms there's no other mannerisms I can figure out how I would know that she felt uncomfortable, okay? That's what I'm getting at is, why that's why I'm having like, okay, when did I see that patient? What did I do? What clues? What am I missing here? Okay, because this is a normal process for me. Okay, that's why I'm like.
He tries to defend himself by saying he might have explained everything during an earlier visit, so he tells the detective to check the medical notes. The detective asks how to get the records, and he explains releases in HIPAA. He claims this will force policy changes to protect patients and himself. They discuss a female resident who was in the room, then left to see another patient, something he says is normal.
I don't have any videos of that.
No, that's fine. Even if you send me like the few pictures that you showed me, that would be more than sufficient, because obviously we can see the hand placement.
But I'm reversed. Okay, I would have been at her head, and that's why I'm like, if it was shoulder stuff, I would have had her on her side too. Okay?
Yes, that's what she said.
So I would have had her on her side, and then I'm compressing, because when you do the fascial, releases, you can do it sitting, okay? But I like to lay them either down or on their side, okay? And then you can compress better front to back. Okay, and then I've got control of their arm, so I can compress if you're on the 4th rib, 5th rib, 3rd rib, you know, because the scapular-thoracic dynamics of the way your shoulder moves, the scapula has to move, and that's why rowers get so many rib problems because of the using the serratus and the scapula. And so when you want to release the rib cage, then you compress from the costosternal to costovertebral compression. Okay, and then you can use the scapula, get it out of the way. But if I'm working rib 4 or rib 5, rib 3, that's breast. You know what I mean? That's breast, and that's breast. But it's compression, it's, you know. And so if she said I was massaging, it would have been like, does that feel better there? Does that feel better there? Take a deep breath. You know, that type of thing. So take a deep breath, move your arm up. I would have been, she would have been laying on her back, and I would have like turned her head, you know, and done like one hand would have been here pushing down, you know, like this. Sometimes I'm here between the breasts, you know what I mean? But so sometimes you're cross patterning, okay? So that you're doing it from this direction, okay? So, but my hands would have been more like this as opposed to like this, okay? And then side lying, you're like this, okay? So like her head would have been like, if this is the body, that's the head, okay? So I would have been like this, okay, with my hands on, so that my thumbs, so like your thumbs connect from the costosternal to mid-axillary line to costovertebral, then you compress the rib, and as they breathe, then the rib you're able to release. It's called a release. It's releasing the rib. Okay, so if I did sideline techniques, that's my sideline techniques. Okay, if it's supine, it's supine. Okay, supine, laying on their back. Yeah. You know, and sometimes you go from prone to supine to seated. To, you know, I mean, you got all these different ways to treat them. You know, that's why I'm like, it could have been any one of those, you know, positions, but that's the positions I would have used for those rib techniques. And again, if she felt offended, I'm like, why didn't I sense that? And that's my burden. But anyway, so I guess.
So it seems like you obviously have, which is great, you have a very set routine that you go through with every patient. Is there any reason you can think of why you wouldn't have walked her through the steps as to what was coming up next or what you're going to do?
Other than if I thought I had explained it to her at the visit before, because this was a follow-up visit. Okay, that would have been the only reason why. Would have been if I thought I had explained things to her at the visit before. Okay. Instead of having, so that's why then I'm just going through it because I've already explained what I'm going to do. You know what I mean? So does that make any sense?
Yeah. So
Nassar was very well prepared during this interrogation. He doesn't contradict himself, and he is doing a good job in covering his crimes.
So I actually leave for vacation myself that week. Okay. So what my goal would be, bar any unforeseen circumstances, is that we have this wrapped up before you and I go on vacation. Okay? So, like I said, bar any unforeseen circumstances, I don't want to leave and go on vacation myself and still have some things to tidy up here. So I guess if that helps, that would be my time frame.
That's good. That's good.
So I have a couple people that I need to talk to. I'd like to get her medical records, talk to our polygraph examiner about pitching for polygraph examination if we can do that. And if you're available, you know, basically her first available spot, we could get you in.
Right.
And then that would help also with the investigation.
Right.
Is there anyone that you think I should talk to or that would be helpful to talk to? I'm going to talk to Dr. Covan because obviously he spoke with her, he met with her.
Right.
He knows you, he knows the procedure, so I need to talk to him.
Right.
Is there anyone else that you think I should talk to?
I think Dr. Lemon, she's another one of our doctors.
Okay.
So Brooke Lemon.
Brooke?
Right, Brooke Lemon. She works with me with gymnastics and she's one of our office partners and stuff. And she knows these techniques, you know, too, and she knows what's going on. You know, I personally talked to her because she's like she's a colleague that, you know, she said, Larry, I watched you for 8 years. And I said, because I was worried about you getting yourself in trouble with that. He goes, and she said, you know, because she as a female, you know what I mean, because she's a female, so that's why I'm thinking Brooke. You know what I mean? Because she'd be a female doctor, you know.
And you said, who is it that I could contact to find out who was in the room with you that day?
Vicky Curley.
Okay.
Right, Vicky, she's our office manager.
Is it C-U-R-L-Y?
R-L-E-Y.
E-Y?
Vicky Curley, V, ends with an I.
Okay.
I think Vicky Curley, right. English is like a second language for me. I'm not very good at spelling.
So as we go along, if there is other people that you think I should talk to, or
I
that would
don't
be...
know what you, like, doctors, that's why I'm not sure what you mean.
Yeah, or basically anybody that may have information that would be relevant to this investigation. It sounds like the dean maybe just got information, kind of second, third hand,
right,
so to speak.
Right. I think it would be Dr. Dietzel, Dr. Kovan, Dr. Lemon. You know,
Okay.
That would be the appropriate, thing for that. You know what I mean? So, Destiny, she's our athletic trainer.
Okay.
Destiny Teachner Hawk.
My pen in there.
Sorry. Destiny, she works with me in the training room. Okay, she doesn't know anything about this. Okay, so she's totally.
Then I may hold off.
Yeah. She doesn't know anything about this,
Okay.
but she's with me in the training room. She's like my voice. Now he's gonna put his hand on here. You know what I mean? So, because I work with the athletes there, and I do the same techniques with the athletes in the training room.
Okay.
And so she's always the one that say, all right, remember he's gonna do this. So she's always over my shoulder talking to the patient. It's because I only got like 15 minutes, there. So it's always a quicker thing. And so she knows my techniques, and she talks, so she helps with the education of the patients, from that to the athletes, you could say. We do this on guys too, in case that matters,
Right.
It's not like just on girls, There's basketball players that, with Covan and other track athletes, it doesn't, I mainly work with figure skaters and gym, but where I see the guys is mainly in the training room.
Okay.
And so, and I've got a few guys that are in the clinic, but the vast majority are females because it's figure skating, gymnastics, and dance. That's my population,
Okay.
But yeah, and I've done this with guys and taped their bottoms too, and all that stuff too. So it's not just unisexual. Okay, so, but anyways, that would be the coverage, I guess. You know what I mean? So. Yeah, so that if I'm just trying to think of where else people have seen me, So Brooke sees me with the athletes at Twist Stars at the gymnastics club, and so so I'm just trying to cover training room,
Right.
high school, Twist Stars, type deal. So but that it is what it is. I mean, I think that should cover it. I mean, because I don't know what you're looking for.
No, that sounds good. And then the only thing that I would ask of you is, I know you've been thinking about this a lot.
Yeah.
But as you continue to think about it, if there's no details too small, so if there's anything that you remember, and you went
The only
through.
thing, like I said, the only thing that I remember is that there was that. I was hoping to, it's just me, how can I help? You know what I mean? That's where I'm thinking, is that where I crossed the line, was because I had intent of trying to talk to her and how can I mentor her and, what's, she's like, what do you want, your career? You know what I mean? It's like, how can I be the mom? How can I, so that's the only thing that I keep thinking of, is that was an intent that I had, was to, as a mentoring, she didn't come here for that, she came in for.
Yeah.
So I'm like, so I'm like, what, I think you had said something about her shoulder's been hurting a long time. That's why I said shoulder. So, where I may have breached by doing something that was out of proportion was I purposefully was trying to get into a role of being able to mentor her. Okay, so by talking to her, you know what I mean? Like building that relationship, and over 3-4 visits, you usually can develop a relationship like that where people then like, you know, gee, I want to be a doctor like you, and, you know, can I rotate with you? Can I, you know what I mean? So, and so that's what I'm thinking of was I off on that too much of a tangent, you know, where my focus was off a bit, where I was thinking of that part and wasn't paying attention to the details of explanations? Was I distracted from that? Was, you know, that I wanted to be the shining light to come in and say, you know, I helped your daughter. You know what I mean? That's and so I obviously royally flushed that, you know, but that was part of what that was the agenda, that you could say that was part of it, was not just the body, it's the mental component too.
So you're thinking, if I'm hearing you correctly, that there may have been a possibility that you were having conversation about other things while going through the manipulations of working on her body.
Right, and that's what that was. I know that exactly, I can't remember, okay, because it's been so long, right? I've seen once a week, then I can remember,
right?
You know, but I remember that as a detail of thinking back, you know, that was an issue. So when I see an issue, I would have normally tried to mentor on that issue. Okay, so that's, again, it's nothing, I'm not singling her out. It's like, when I see an issue, I want to become a mentor. I want to be able to help the person from that standpoint too. Okay?
Right.
And so that's just, okay. So I don't know, that would be the details.
Yeah, and again, you know, sometimes as you're, and I'm sure you've thought about it a lot, but as you continue to think about it, if there's anything that comes up, don't hesitate to get back in contact with me and let me know. What I will do, though, I will talk with our polygraph examiner tomorrow.
Okay.
So I'll be able to follow back up with you tomorrow,
Okay.
unless she's off. I don't think she's off.
Right, would I have to go?
So we probably won't do it tomorrow, so you don't have to worry about that. Continue on with your plans.
Okay.
What I will do, I will talk with her tomorrow if she's not off. I'm pretty sure she's here, to see if it's something she thinks that we can do, because I will defer to her expertise.
Okay.
As far as whether she thinks that this is something that we can test on.
Okay.
And then what we would do is that I would give you a selection of dates and times that she has available, and then you can pick whatever date and time you want. Right, which would be good, right? We'll get you in here, get it taken care of. And like I said, she runs those at 9 a.m. or 1 p.m. They're generally a few hours long. The reason for that is, again, from whatever you've seen on TV, that stuff's not true. The test is a very small portion of the polygraph examination. So what happens is she has to do very much like you have to do. She has to get to know you a little bit before she runs the test. Because you're only tested, obviously, against yourself, right? So basically, she has to see what your baseline levels are. Like, she will make you lie. Hey, what number do I have up here? You lie to it so she can see how you spike when you lie. And I'm using layman's terms. She will explain it to you in technical terms. So basically what happens is that she has you lie to something completely unrelated to this. She'll write a number up here and say, did you pick this number? She has you lie to that, so that way she says, okay, here's what your charts look like when you lie. She goes through the exact question she's going to ask you, so there's no surprises. You know exactly what questions she's going to test you on. There's 3 questions that would be relevant to this investigation. And what those questions would be for, or what I'm hoping she'll be able to test for, is, again, what we're looking at is medical touching for sexual assault touching, right? So she would form like 3 questions after talking with you, because she needs to get to know you and find out, hey, what makes you tick? What do you think is awful? And then she formulates the test questions from that, and then you go through a couple practice runs to make sure that you're charting okay. Or say, for example, you know, even if I were to sit in the chair and be a little bit nervous, she'll say, are the lights on? Yes. Kind of to bring your levels back down. But again, she'll go over that all in technical terms and explain it way better than I can. And then she'll run the test. That is the small portion of it. She normally has to run a couple tests to make sure that each chart is reflective of the other chart, that she's not getting abnormal readings or anything like that. And then you'll know right then, which you're sitting across from me today, you should know what the answer is going to be, right? you should know what the answer is going to be, that, hey, it's showing that he's honest.
Oh, yeah,
Right?
I'm sorry, right.
Yeah,
Right.
so there should be a question in your mind of
Right,
what the
right. The
outcome
result
should
would
be.
be, right,
Yep.
right.
And then I'll be available here too, because obviously it's my investigation.
Okay.
So we would meet afterwards. Well,
Okay.
basically when you show up, I'd come get you again. I'd walk you down and introduce you to her.
Okay.
She runs the test. I'm here throughout the whole thing though. And then after the test, I would meet with you again.
Okay.
And again, you know, you're saying, hey, here's what I did. Again, from what I'm seeing,
Right.
you know, it seems like that's the case.
Right.
And then,
But it just frustrates me that it like I said,
but
all
it
this-
affects you in a whole nother capacity.
Yeah. That's the whole thing. It's like this. It's whatever it takes. You know, let's get through it. But I just want to get through it because I got to figure out how to make amends. You know what I mean? It's like, how do you change your life? You know what I mean? So that you don't have this ever happen again. You
Right.
know what I mean? And I've got to take it out of my hands. You know, and that's where it's, you know, it's going to cost money, and that's just the way it is. You know, and that's just tough. You know, but it's worth it to have someone else in the room, and that's, you know, as I keep talking, as we're talking, you know, that's the one thing. That's the one thing that we wouldn't even be here right now, I think, if that person didn't, because that's what you said is when that person left the room is when she had that change of thought, and that's if that other patient would have been late, if, you know, there's so many, like, if that patient would have been late, if there was no other patient, you know, then if it was the last patient of the day or whatever, you know what I mean, if that person would have left the room, we wouldn't be here right now, you know.
Right, or we may just have to go talk to that person that would say, yep, hey, here's what I saw, right? So that's that would be quick and easy for us.
Right, exactly.
And unfortunately, that's not where we're at. And so, you know, because it sounds everything she's concerned about obviously happened after that person left.
Right, yeah. Like I said, I wouldn't know, you know what I mean? Because I don't remember when the person left or what have you. I know that the person would have left, and if you said about 3/4 through, so my appointments are long, that makes sense. Because, you know, if the other person that's came into the room, has been in the room 40 minutes or half an hour or whatever, you know what I mean? That makes sense, that they would have been going to see another patient.
Okay.
You know, so that makes sense. You know what I mean? So that would make sense. So okay. So I am whatever you need done. Just let me know. Okay. You
Well, I appreciate you coming in here. I didn't expect you to be like, I'm coming right now. So I appreciate that.
Yeah,
That's extremely helpful.
Yeah. No. It's the sooner. This has been in a way therapeutic for me too. Okay. It's like I got a chance to purge. You know what I mean? So, thank you, you know, for that. It was nice to be able to purge, to let it out, okay? So that helps, okay? So I do appreciate
Yeah, no, and I appreciate, like I said, I know a couple of times you're like, hey, I'm talking too much. We want you to talk a lot, okay? Because the more information we have, the more we have to work with.
Okay.
And so that's helpful. And again, so as you move forward, no details too small. So if you do think of anything,
that's going to be that's when every time you say that, I start going back in my head, okay, stop saying that. I just feel like I'm replaying.
But that's the way to help yourself,
Okay.
you know, so that is the way to help yourself, is to remember any detail. And again, I know you see a lot of patients, and I know we're a few weeks out from...
Yeah, but what I don't want to do is convince myself of I don't want to convince myself.
Right, and I won't want you to do that either.
You know, like, oh yeah, well I remember.
No, by no means,
like, you
right.
know what I mean?
I won't want you to do that either.
You know, I don't want to start, distorting the memory in a sense. You know what I mean? So that what is she looking for? What are her detail? What am I missing?
No, I would not want you to do that at all. And if you don't remember, hey, you don't remember.
Right. I don't want it to be used against me because I can't remember. You know, but at the same time, I'm like, I know I talk to my patients. I know I explain things. It's irrelevant what I know. It's her perception of what she heard. Now, if I said, even if I remembered saying specifically X, Y, Z, if she heard A, B, C, then does it really matter that I said X, Y, Z?
Right, which is true.
What I'm saying? Okay, that's why I'm like...
That's true in our profession, too.
Yeah, that's why I'm like, okay, she didn't get it. She didn't get it, okay? And that's the issue. She didn't get it, okay? And for whatever reason, whether I was distracted, you know, I mean, it could have just as been as easy as that. I could have been distracted and thought I had explained things. You know what I mean? So that's what I'm saying.
Which is a perfectly plausible explanation.
That's it. I mean, like, so I don't want to hallucinate and start.
Yeah, and I wouldn't want you to do that either.
Reconstruct the thing, you know what I mean? So, but if something does come to me, you know, I'll tell you, of course, okay? But I'm trying hard, okay? So.
Yeah, no, I appreciate you coming in here, especially I called you up and you came right in, so that's greatly appreciated. And you obviously got a couple different processes you're dealing with. I mean, your employment process, this process, the university's process, so it's a lot to have to deal with.
Yeah, well, thank you, though, for your time. Thank you for being you. You were good.
Shortly after he was let go. However, even after that interview, MSU Police later sent a warrant request to the Ingham County Prosecutor's Office. The prosecutor declined charges after reviewing the victim's statement, Nassar's statement, and videos of medical procedures. And the prosecutor's note essentially treated it like a communication/chaperone problem, telling police to advise him to have a witness and explain better. A few years after this interview, Nassar got pulled in for the second MSU Police interview in late August 2016 because a new complainant, Rachael Denhollander, contacted MSU Police on August 25, 2016 to report sexual abuse by a big MSU sports doctor. She and her husband met with date. Sergeant Andrea Munford brought documentation and walked investigators through how Nassar's training videos could look legitimate on camera while still hiding what she said happened during appointments. The next day, Munford interviewed Nassar at the campus police station, starting by revisiting the 2014 complaint and pressing him on his methods and why he sometimes examined patients without anyone else in the room. Munford noted he appeared rattled and struggled through parts of the questioning.
Sorry.
I'm Andrea Munford.
Hi, nice to meet you, Larry Nassar.
Thanks for coming in so quick, too.
Yeah.
Obviously, you're not under arrest, so you can leave whenever you want. Anytime we bring someone to interview room, we make sure that they know that. I know you talked to Val O'Brien, one of my colleagues, a couple years ago.
Right. Okay.
What I want to talk to you is kind of go back to that situation. Sure. And I know that you guys had, papers on this, talked about maybe redoing some practices and things in relation to that. Reference that situation. What do you recall about that investigation?
Right, that had, concerns over the form of treatment that I was doing, and that I talked about having to do the reasons why I did it, from a manual medicine standpoint. And there was a student that was in the room that had to leave to start because I was behind. We had to start another patient, and so we're like, always have another person in the room.
Right.
You know what I mean? And I've been trying to adapt my techniques so we won't get into the same situation.
Okay. What practices have you changed in response to that?
I've been trying to have people in the room,
okay.
And trying obviously not to get into that same situation. You know what I mean? Like, has there been another complaint? I'm just like confused right now.
Well, we're trying to see what things have changed, what practices.
Okay, yeah. So I'm trying to do things where the difficulty is with the hands-on is I'm trying very hard to do things where I'm not being nearly as invasive, but it compromises things. So I am trying to modify that and having students there and having family members there, and I document in the chart, so-and-so's in the room, so my documentation's changed. I'm trying my best to do it over closed, and that's sometimes the hard thing is the tightness, it's like the close gets in the way, but so I'm very, there's not a day that goes by that I don't think about that,
Yeah.
Because that was a very scary thing, in my life, obviously. So, and I don't want to get into that. So I was like, oh my God, what happened? Like my heart is hurting. It's like what the heck? So, I hope, that I've made the appropriate changes. Because it's, and I've done a lot of education. I'm really trying hard at educating so that and I always thought I was good at educating, but I'm trying to educate even more.
What do you mean by educating?
Explaining what we're doing.
To the patient?
To the patient, family, exactly.
Right. Have you had any instances where there hasn't been anyone in the room for an exam? since that time?
There'd be some on occasion, of course. You know what I mean? That just is the way that with medicine is now. It's difficult. You know what I mean? So yes, that has happened.
And what circumstances caused that to happen?
The patient is an adult, you know, like she was too. But again, when I'm doing that, I'm trying not to do those techniques. You know what I mean? So, but I'm trying to, you know, like really trying to explain things. And I haven't had any complaints, you know what I mean?
During that technique, though, has there been situations where someone's not in the room?
I would probably, who's a doctor, you know what I mean?
You do that technique on?
She said it saved her career, you know what I mean? So she was just in today.
Can you explain the technique? I've never been to pieces, but I know.
And I sent her videos, you know, too. I mean, like I lecture on this. That's the thing that's frustrating. It's so, you know, the sacrotuberous ligament, it runs from the pubic symphysis, the falciform process. It's like the pelvic floor. Okay, you won't understand the stuff. So you're really coming in, like the way to describe it, you know, even in some of the videos is, it's like you go towards the labia and go lateral. So you're going in and apart. Okay, and then there's muscles that attach to the ligament, and so as you're treating that, you can feel the release, and that's a great teaching thing too. It's like I have the student feel their rib cage, okay? And then I go and I release that, and they're like, oh my God, what did you just do? You know what I mean? Because they can feel that effect, you know, from the way that the muscle, the costellostoracic runs down from the rib cage into and entwined in the sacrotuberous ligament, you know.
So when you're doing that, and you said you look for the release, what are you feeling? Like, what does...
You feel tissue tension.
Okay.
Tissue tension changes. It's all about tissue tension. Right? And so you're trying to, like if I pull on one part, you know what I mean, like you can see how that affects another part.
Right.
So it's the same thing like a run in the pantyhose or something like that. You know, like one pull here can affect, and we talk about triplaning and fascial releases where, say if I rotate, extend, and back, you know what I mean, that like wringing out a towel. You know what I mean? So there's, you know, you may have to go clockwise, counterclockwise. I always talk about the different vector forces to make the effect above. You know what I mean? So it's a three-dimensional, you know, I call it triplane, but like a three-dimensional effect to it, because it's not just that simple. You know what I mean? So.
Gotcha. Okay. Now, how long have you been doing this technique?
I have video from 30 pounds ago, from like the 1990s. I'm trying to remember. It would have been in the 1990s. You know what I mean? Like early 1990s.
Right.
You know, and I've made videos very clear. You know what I mean? And I've lectured. Oh yeah. You know, and I've lectured.
Unlike the start of the first interview where he was confident and bossing around the detective, here he is visibly nervous and flustered.
Lectured. Oh yeah. You know, and I've lectured. And
are those online anywhere?
They're on my G drive, like I said, that I've sent. You guys should have all of that.
Dropbox or something?
Yeah, no, it was it might have been Dropbox then.
Back then.
Yeah,
a few years ago.
Yeah.
So how would a patient be laying to get that treatment?
Prone, and then they're lay prone, you know, and then you're doing that. And then I can do it seated. I talk about doing seated. I can do it standing. I can do it supine. So, yeah, you can do but
Would they be on their side?
On their side?
Yeah.
Yeah, you can do it on the side, too. I mean, like I show them in all the different directions, but it's rarely on the side. It's more, if I'm doing something on the side, that's more for the SI joint. That's the SI joint.
What's the SI joint?
Sacroiliac.
Okay.
Right here. You know, so that's where I might be like lifting. You actually sometimes like lift the hemipelvis.
Okay. And so where on their body would you touch
your
them?
Here would be, if your hands are like this, you know what I mean, you could be actually holding that, like this would be up towards the back and this would be up towards the pubic symphysis, and you could be like a U shape, and you can lift and shift from that position on the sideline. Generally, with the sideline, that's the lift and shift, and the coccyx. You know, if there's a coccygynia, you know, problem, then sideline. You know, can be treated sideline.
Okay. All right, but you wouldn't, like if somewhere on the side, you wouldn't be doing the same
It'd be an
treatment.
alteration. It'd be a variation. You got to
Okay.
adapt, like just like standing. You know what I
Right.
mean? Like, so you change it because of the three-dimensional vector forces. Is depending upon whether what position they're in, it's going to have a different effect. So normally you try it one way, and one way doesn't work. Then you try to seed it. You know what I mean? Because of the way that you can affect. And I try and teach them if it works. I've taught a lot of patients how to do it themselves.
Okay.
You know what I mean? Like self-treatment. Like, okay, I told them it's like giving themselves a hand wedgie. You know, it's like reach and pull, reach and pull. Like you're picking a wedgie, you grab, and then you pull off to the side, or you pull front, or one of those three main vector forces is.
Okay. Would this ever involve like digital anal penetration?
Only if we're doing a coccyx,
Okay.
problem. You know what I mean? So if there's a fractured coccyx or a coccyx disorder too, so that you can come perianal because it comes up. When you have the pelvic floor attachments, but you can come to the pubic symphysis and also towards the coccyx. You know what I mean? So it's your lift, I call it the lift and shift, when you're doing that, So that's a very common to do one side or the other, and that's the straightforward. So like if you're here, here, or here, there's three different vectors, and that would be the straight vector. Like if I'm doing ribs a lot, then I would be going straight.
Okay. All right. Well, the reason I'm asking is that we did have another complaint.
Really?
Yeah. And it's a patient from a while ago.
Okay.
And she does describe some things that sound to me like they're out of the norm
Okay.
from your typical treatment.
Okay.
This would have been in.
Wow. Okay.
And she was receiving some of that type of treatment, but
Okay.
then there were also some other ways that she was touched that she
Okay.
would be on the treatment.
Okay.
So that's why I'm asking about penetration.
Only if there'd been coccyx, and I would have, and it would have been, because you can push hard. There's a lot of room down there, but I wouldn't have gone intra-rectal. You know what I mean? Like unless I was purposefully treating the coccyx itself.
Okay.
You know what I mean?
What would you use to do that? Like what digit or what part of your hand would you use?
Well, normally I'm using my thumbs, as I'm coming up this way. You know what I mean? Then if I actually have to fix a coccyx, then I'm going to be using my finger inside and my thumb on the outside.
Okay.
To
do you wear
manipulate
gloves
the
when you do
coccyx.
this?
If I'm going to go intra, yes. You know what I mean? So.
This was a long time ago, so I don't know how many of your patients that you remember from back
Right.
then.
Yeah, I don't. How many patients? Right. Yeah, no, I don't remember.
Right.
No.
Well, this is a little bit of a personal question, so
Yeah.
I'll just be totally honest.
Yeah.
I mean, you have these young girls in there. They're
Right.
athletes. They're
Right, but they're usually with their parents. They're usually with
yeah.
their parents. So that's why I explain a lot. You know what I
They're
mean?
athletes. They have
Right.
lovely figures.
Right.
They're very cute girls.
Right.
Do you ever get aroused during these exams?
Do I get aroused during the exam?
Yeah. Like, do you ever get an erection?
Well,
Or, I mean,
obviously you don't. You know what I mean? So
is there a reason that you would during an exam?
I shouldn't be getting an erection during an exam.
Right.
Okay.
Well, this is why I'm talking to you about this,
Yeah.
because this young girl and her mother both observed this on more than one occasion during treatment.
That I would get aroused during an exam.
Visibly an erect penis. Not exposed, but through your clothes.
I can't explain that because that should when I'm working, I'm working. You know what I mean? So I don't.
Well, you can understand why this would be
Well, yeah.
a concern.
Yeah.
That you didn't wear gloves.
Right. Okay. But I mean, but it was like doing her coccyx. Actually digitalize the coccyx, like for a coccyx treatment.
The words that she used were he anally penetrated me with his thumb.
No, see that wouldn't have been. See, I would never do that for the coccyx. I would use if I'm going inside, I'm using this. If I'm penetrating, it's not penetrating. It's pushing off to the
So I
side.
penetrated her. Okay. Again, this was some time ago.
Yeah, but I'm lifting up and I mean it's not going inside her rectum. It's lift. You can get there's a lot of soft tissue there, and you're lifting through there. I would be wearing gloves if and I would be using this finger. Okay, when I'm using my thumbs, I'm lifting. You know what I mean, to try and separate the tissue and releasing through there. You know,
And this is what you're describing to me is very different than how she's describing her experience.
Okay.
All right?
Okay.
That there was no explanation of what you were doing to her or to her mother. And so you can see kind of the consistency from what happened a couple years ago.
Well, no, but, okay, but I mean, okay, but I would be, I mean, like, that's why I have so many lectures and stuff. I mean, that's what I'm known for is my education. You know what I mean? So I don't.
Your education to
students.
To students,
right.
But not necessarily
to patients. Well, I try to. You know what I mean? Like I am. I'm like, I've never had anyone, you know, what's confusing to me about is why wasn't there anything said back when I was treating them if they felt that uncomfortable? You know what I mean? It's like if I'm talking to the patient.
Okay, put yourself being a teenage girl.
Okay.
All right.
Okay.
Most people that are sexually assaulted are very uncomfortable. They don't know what to say.
Okay.
They're in a position where they feel.
But the parent was right there. You said the mom was there?
She was in a different part of the room. She couldn't observe.
It's an exam room, a different part of the room. It's the same room.
Behind where you were.
Okay.
But I don't think that really the focus is why is it being brought up now. I think
I'm just trying to think of what
it has been brought up, that there are discrepancies in what she's telling me as compared to the technique that you're describing.
Well, yeah, but I'm trying to think of, I mean, you know, this is trying to think of what I would have been doing differently. That's a long time ago, you know. I mean, for me to remember everything, but there would be, like I said, what the discrepancy would be is I'm using my thumbs. That's not a discrepancy to release around the coccyx. Okay, where I'm actually lifting. Okay, so that's what I said. If I'm treating through sacrotuberous and not the actual, because I'm trying to release the tissues that come up to attach there. So I am pushing hard, okay, with my thumbs, okay, and I'm separating, okay. So if you have thumbs over there and you're separating, but I'm not going in, if you're going inside you're going to be using your finger, okay, not your thumbs, and that's consistent with what I'm saying with what she said. So if I'm saying yes, that I'd be using my thumbs, how's that inconsistent?
Well, if your fingers, and pardon me, gesturing, are doing some type of.
Well, my fingers are up here. My thumbs are at the coccyx.
Well, that's not how she's describing it. Now, your fingers are vaginally penetrating her.
What?
And then your thumb anally penetrated her.
No.
So I don't see where that falls in line with that technique.
Right, and I don't see how that would be accurate.
More than once, or more than one treatment.
I'm just working the floor, you know what I mean? But I would not be. How would I be putting my thumb and fingers? You know.
It is clear to the detective that he seems very nervous. The detective makes him spell out the technique in plain terms, positions, hand placement, and why his hands would be near the pelvis at all. He admits a rectal exam could happen only for a coccyx issue, but claims it would be rare, clinical, and done with gloves and specific finger placement. Then they go back to the previous complaint and asks bluntly about arousal during exams. Nassar denies it, but the detective says the girl and her mother noticed it more than once. When the detective repeats the allegation, penetrated with his thumb, Nassar argues that description doesn't match his method and insists she's misunderstanding what he was doing.
That would not be correct. You know what I mean? I am.
Now, if there's some type of treatment where she's on her side, would you have any reason to touch her breast?
If I'm treating ribs, so if I'm treating ribs, that must have been, like I said, I would have been pushing and touching ribs, okay?
How would you touch her breast to do the ribs? I mean, demonstrate on yourself.
Right, you're moving the tissue out of the way. You're moving the tissue out of the way to try and get down between the breast and the rib. Okay, so you're lifting and shifting again because you're moving the tissue out of the way. So if I'm moving tissue out of the way, I got to get down to where I'm making contact, you know, with the rib. Okay, so you try and move and adjust. Okay, or the same thing here. If I'm on the head coming down, you're pushing down, or if you're off to the side, you're pushing off to the side. But you're you know, there's ribs that are underneath that area, so you're trying to slide through and across.
Okay, that makes sense.
Right.
But this girl saw you 5 times, and all 5 times there was something that with her knowledge of what that treatment was, because she had some knowledge of it, went beyond that. The touching of her, the digital penetration of her anus, touching of her boob, and she could visibly see at that time that you had an erection, that you were aroused. Okay, she describes your demeanor, your behavior, your physical reactions, and being able to see an erection. Okay. So, I know it was a long time ago.
Right.
I'm here to get your side of the story because this is very concerning.
Well, yeah. I mean, I try my best to be appropriate, professional, you know what I mean? And I have no understanding of why that would be occurring, okay? Like, I'm a male, you know what I mean? But
has it ever happened in an exam or treatment before?
You are, I'm focused on my treatment, you know what I mean? I'm not trying to gain any type of sexual pleasure out of working with my patients, okay? I mean, that's what you're trying to ensue or whatever.
That's what I'm asking you.
Right, and I'm saying, no, I don't get sexual pleasure out of working with my patients. That's not what being a physician is, not what I'm about, okay? What I'm trying to do is release tissue and work through them, but I'm not trying to get my jollies out of this, okay?
So explain to me, like, when you're doing an exam, is it physically taxing on you?
Yes. Oh, yeah. Your medicine is physically taxing, yes. You know what I mean? That is, there's no question about that. You know what I mean? Because you're moving body parts and you're pushing and you're really, and for me it's a lot of cerebral where I'm trying to visualize where the fascia is going, and pushing and moving. Okay, so I mean, I'm working my best to try and allow that treatment process to occur, and you're really trying to feel what's happening in the tissue. Okay, and yes, you're moving tissue out of the way. You're pushing in and separating. Okay, and you're trying to feel with one hand you're pushing, with the other hand you're monitoring to sense what's happening at the other end, and then you can compress and mobilize, but to so I could see how people could feel, because there's a lot of tissue and I'm separating, but I'm trying to explain things while I'm doing things. Are you okay? Does that make it feel better? Like when I push them, like, does that feel better? Is that helping? You know what I mean? Am I pushing too hard? I'm constantly discussing that with them. You know what I mean? Like, does it help?
What would you say prior to doing this treatment?
What would I say prior to doing the treatment?
You're at a doctor, someone that you trust, and all of a sudden, his fingers are essentially in your vagina, and with no explanation.
I would have explained it. I don't understand why she said I didn't explain it, because I always explain, okay, now you're going to feel like pressure.
But you didn't explain it 2 years ago.
Yes, I did.
I mean, 2 years ago, she reported pretty quickly after it happened. She's not going to forget that she received an explanation.
But I do explain. Do you know what I mean? That's what I'm saying is, like, I don't, that's I'm like, okay, I'm putting pressure, compressing, separating, you know what I mean? Like, I'm going to, my hands are going to be pressing on you here, and I'm going to be pushing off to the side, or, if this hurts, let me know, but I'm treating it and just talking at the same time. You know what I mean? So as I'm going through it, it's not like I sit and explain everything to start with and then go do it. I'm talking through it too. You know what I mean? It's like, how does that feel? I'm getting real-time feedback from them. Okay, so as I'm doing it, like, does this hurt? Are you okay? Is that feeling better? Okay, so it's not like it's a dead silence and I'm just doing things. You know what I mean? I'm constantly talking, with them to get feedback. Okay, did they say anything about that? But that's what I do. I'm constantly talking. Does that make it feel better? Make it feel worse? And I'm adjusting based upon that.
Would there be a situation that you wouldn't wear gloves during an exam like that?
If I will wear gloves if I'm actually, like, manipulating the coccyx. You know what I mean? Because you're going into rectal. You know
what if you're going vaginally or even just outside?
Well, if I'm just outside, no. You know what I mean? Yeah, I even say that on the thing. As long as you're staying external, you know what I mean? Because you're external, okay? And you're sensing, you're using to push, to lift and shift, because you're staying. You know what I mean? Like, you're staying lateral to that. So you're pushing in central and then lateral. Okay. So, but you know, so if you have like the vagina here and you come in here pushing, you can see how you could, you know, like feel, or they may have as a teenager having that sensation, but I'm not going intravaginally. I'm going extravaginally, but pushing in through the pelvic floor. Mm-hmm. Okay, so this is the pelvic floor. You know what I mean? You're here and coming over. There's tons of room there. Okay, mm-hmm. And so that's what I'm saying is like that as I'm doing that, I'm asking them, you know, are you okay? You know, am I pushing too hard? You know, is this hurting? You know what I mean? Do you feel better up there? Am I monitoring hand?
Do you ever ask them if it feels good?
Feel better or worse? You know what I mean? Does that feel better? You know what I mean? Are you doing okay? It's always better, you know, because I'm trying to see, okay, do I need, remember I said about the different adjustments, mm-hmm. because do I need to go this way, or that way? It's based upon how they're responding and how I'm sensing the release, because I can sense the release, but I can't sense their pain. Mm-hmm. You know what I mean? And are you okay? You know what I mean? that's the thing that's very irritating to me, you know, is that if I'm asking the patient, you know, for feedback while I'm doing it, that's how I always feel like I'm okay, because I'm like, are you okay? Are you okay? You know, like you're talking in real time, mm-hmm. you know, with them. Okay, am I pushing too hard? Is this hurting? You know, like this, because you know, you don't want to push too hard to hurt them. You know what I mean? So, you know, does that feel better? Feel worse? You know what I mean? And then they respond. You know what I mean? I hope. You know what I mean? So, but that's what is frustrating to me, is trying to get an understanding of why there was that lack of communication. You know what I mean? But when you're talking to them in real time, you know what I mean? Like I'm asking their feedback.
But in a situation where you weren't talking and they didn't know what you were going to do to them because they had no prior explanation, I mean, would a girl that young speak up?
When you're trying,
if she's wondering if she's not feeling okay, but she thinks it should be okay, and thinking about it later, then she realizes that it was not okay with her. I mean, there's lots of reasons why people
I can see that, you know,
and then seeing that you're erect and feeling on more than one occasion and feeling very uncomfortable.
Yeah, well, it'd be nice if I had, you know, whatever. I mean, I can't speak for her, but if the parent also and her felt that, it'd be nice if there was some communication where I'm asking for communication. Mm-hmm. You know what I mean? So, but that's...
And we can't go back to having that, but this situation as it is, I mean, there are some things that, even to me, hearing you explain it one way and hearing how she explained receiving the treatment was very different.
You know, I mean, trying to explain it, you know what I mean, the best that I can.
Right.
You know, I mean, I'm trying
But for her, she very vividly, you've done it hundreds, maybe thousands of times.
Right.
Her, she had done it 5 times, and it's very vivid to her how she received what you presented as treatment, what she felt very different as.
Okay. And did she ever make any... I would assume not, otherwise I would know, you know, like concern, you know what I mean? Like, did I ever like ask her something and say like, does this hurt, and then not adjust it or not listen to what she was saying? You know what I mean? Like the feedback, would I respond to her feedback? And was she telling me she was getting better? Well then, yeah, I mean, because that's how I'm asking, you know, like for feedback. I want to know, you know what I mean? Am I helping? Am I not helping? You know what I mean? And that's and it's made, like I said.
He explains that touching her chest could happen during rib work because he says he has to move tissue out of the way to reach the ribs underneath. But the detective comes back hard. This girl claims it happened 5 times and that it wasn't just ribs. She says there was anal touching, breast contact, and that she and her mother noticed he was visibly aroused through his clothes. Nassar denies getting any sexual pleasure from exams and tries to reframe it as physically demanding medical work. The detective paints the patient's point of view. No warning, sudden intimate contact, and then realizing later how wrong it felt. Nassar keeps insisting he always explains and talks through it, while the detective says her memory is vivid and the details don't match his version.
Like I said, even with be able to continue standing and walking and doing our job. You know what I mean? It is very personal. You know what I mean?
And it's also received very different when you're doing it on someone from the medical profession who has a lot more knowledge of what you're going to do.
Right. I can't talk about something I don't know the situation. You know what I mean? Like from that long ago. But that's what I try. I do this all the time. You know, I talk to people. I'm trying to get feedback, and I'm trying to go off of their feedback. You know, and there's like this trust too on my part of that I'm trusting them to tell me if I'm hurting them, if I'm pushing too hard. Are they getting better? You know what I mean? Like that's part of the only way that I can really know, you know what I mean? It's by having the feedback, you know what I mean? And I hope they said that I was asking them and trying to ascertain how their comfort level is, you know what I mean?
In some ways.
You know, because the last thing I want to do is hurt someone, you know what I mean? And so if you're concerned because you're in their private area and you're asking them questions, and if they're not giving you the feedback, then how do you know that if you're saying, am I hurting you? And they say no, then how do I know that I'm hurting them? You know what I mean? And I'm trying to be realistic with them, you know what I mean?
And I understand that in a treatment, but in a different situation, and I think what concerns me here is the visible signs of your arousal, where this young girl is afraid.
Right. Well, I don't want people to be afraid, obviously. And I was trying to, you know, with my patients, I'm trying to actually help them, not hurt them. Okay? You know what I mean? That's, you know, that's the bottom line, I guess you could say. You know what I mean? That's my goal, you know what I mean, is to help them, not to hurt them.
And so, just to clarify, you're saying that during these visits, these treatments where you're dealing with young to old teenage girls who are very physically fit, very attractive, that you don't get aroused when you're touching. I mean, you're essentially touching their genitalia, touching their breasts.
You know, I'm not purposely trying to get arousal from doing any treatment. I mean, come on. You know what I mean? I'm not purposely trying to gain some type of sexual gratification out of doing that. That's not what I'm doing. Okay, you know, if there was arousal, it's you know what I mean, like it would be because of whatever, I don't know, but I'm not trying to, you know what I mean,
I don't know.
Well,
I don't know.
When you're a guy, sometimes you get an erection, you know what I mean, but I don't, that's
you get an erection when you're aroused.
You know, but you know what I mean, like I'm just saying that, you know, I'm not trying to, how do you say this? And if I had an erection, I understand why I would have an erection from doing the treatment, you know what I mean, from what I'm doing, okay? And that's rather embarrassing, you know what I mean? It'd be rather embarrassing, okay? I mean, to have that happen, okay? So it's just like, you know, that's not appropriate, okay? And that is just not professional, you know what I mean? I don't know how else to explain it, but that's, you know, yes, you're a guy, you know, but you know, I'm trying to not, and yes, they're young ladies, but I'm trying my best to be professional, you know what I mean? That's why I'm talking with them too, is I want that feedback, I need that feedback, because if I don't, then how do I know that I'm, you know, if I'm in their area and I'm talking to them and asking them, you know what I mean? It's constantly asking them, you know what I mean? Like, then I feel like, okay, they're giving me the positive feedback. If they're not, I adjust, you know what I mean? So how can you not, if someone is telling you you're okay, how do you know you're not okay? I mean, like, if you're giving real time, are you okay? Is this helping you feeling better? Okay? And then if they say, so, you know, if I'm not getting that feedback, how do I know that I'm not, but then they find out that I'm hurting them, that's bad feedback. That's not what, you know, I mean, what I'm...
Do you do a similar adjustment or technique on male teens?
Yes, exactly. Whether they're male or female, it doesn't matter. You know what I mean? It's the same thing, you know, because you're still having to treat the sacral tuberous or what have you. Yes. I mean, whether it's a male or female. Okay. Yes, you know. And it's just what can I say? The thing that is most frustrating is that the amount of conversation that I'm trying to have with the patient to try and prevent this from happening, okay, is important. And if I'm asking a patient, does this hurt or is it helping? You know what I mean? And they don't tell me the truth, how do I know then that I'm hurting them? Mm-hmm. When I'm doing this real time, you know what I mean? Like I want that feedback and I adjust based upon the feedback. Mm-hmm. Okay? And I think that's the part that I'd like to, have some information about. You know what I mean? It's like that's the whole protective mechanism so that I'm not harming someone, mm-hmm. So that there's real-time feedback.
Right.
Okay.
I understand what you're saying about the feedback, but I think there's a difference between like physically hurting someone and then them feeling touched inappropriately.
Right, but
and I think that's a different scenario of a comfort level to give feedback.
But that's hurting, though. But that's hurting. Mm-hmm. Like if you're doing something inappropriate, that's hurting. That's not helping. You know what I mean?
Well, hurting mentally. But it may not be causing them physical pain to give you physical pain feedback.
Yeah, but there's a comfort level. If you're doing something and you're asking them.
Have you ever had someone do something that made you feel uncomfortable and you doubted saying anything?
Not, like you mean like.
Anything. It doesn't have to be physically anything. Where you thought, I don't feel right about this.
Yeah, you get your gut feeling. Yeah. I see what you're saying.
And your instinct was probably correct.
Your gut. Well, but that. I don't know. I'm just saying. Yeah, you have your sense. Everyone has like a sense about them. But.
I was going to give you a business card, and I realized that I don't have it. I'm going to go grab one and give you a moment to think and see if you have any other questions for me.
Yeah, I want to know what's going to happen. I'm very.
I think similar to last time, obviously the university has to be notified. I have no control over that.
Right.
So I'm sure there will be conversations with your dean or whoever, however that looks. I'm sure you're familiar with that process. We don't get super involved in those processes.
Right.
But, and then I will continue to investigate.
Okay.
There will be other witnesses to talk to, things like that.
Okay.
And so like last time, there will be an investigation.
Right.
Okay?
Okay.
All right, I'm going to go grab a card. Just so that you can have my information. I'll be right back.
Okay.
He keeps circling back to the same defense. He says his job depends on trust, real-time communication, and patients telling him if something feels wrong. He claims he's trying to help, not harm, and insists he isn't seeking sexual gratification, yet he awkwardly admits that, as a guy, an erection can happen, even though he calls it embarrassing and unprofessional. The detective separates two issues: physical pain versus feeling violated. She explains a patient might stay quiet out of discomfort, even if something feels wrong. Then she lays out what happens next. The university will be notified, witnesses will be interviewed, and a formal investigation will continue, just like before.
Leave over their business card. Before I forget, I'll give you one of those as an email, and also the phone number that I left for you.
I don't know how to explain it more than what, I can't go back in time and remember that far, okay? But I'm telling you, honestly, it is, I'm trying my best to help the patient. I'm trying to get real-time feedback from them, okay? Mm-hmm. And I've helped so many people, it hurts my brain to think that someone would, as I'm talking to them, I just don't get it, because I'm trying to prevent that. I don't want to hurt someone, so I'm trying to get real time. Am I helping? Am I not helping? And I try and adjust based upon what they're saying. And so it's hurtful for me to think that I've hurt someone. That's just not who I am. Okay, and I'm trying my best to figure out how I didn't read the situations, because that's, you're trying to assess comfort level, too, and I obviously offended her, you know what I mean, there's no question, and that's not good, you know what I mean, and I don't want to offend anyone, you know what I mean, that's not the intent, that's not the purpose, and I'm trying to do the feedback to know if I'm making a difference or not, you know, and so I usually leave feeling good because I'm helping someone, you know what I mean.
What would you say if I told you that there may possibly be other complaints?
I mean, I'm doing this treatment a lot, you know what I mean, so, you know what I mean.
But why would there be those consistent complaints?
You work down there a lot, you know what I mean, if I'm working there a lot, okay, what's gonna...
But if repeated girls are saying that you're not explaining the process and that...
But I feel I'm explaining the process. They may not be understanding it, but I think I was explaining the process. You know what I mean? Like if I'm explaining it and they're not understanding it, then you would expect that they ask for more information.
Have you had other complaints from patients?
No, just the one. You know, but you know, if I've had to explain things to patients. You know what I mean? Like, but.
But if they afterwards said, "I feel like you invaded."
No,
violated.
No, nothing like that.
Okay. About how many times do you think you've done this procedure?
It'd be thousands, you know, over the years, because it's been a long time. You know what I mean, that I've been doing it, you know. So, and like I said, I lecture on it, and it is invasive. And I'm trying to explain things, and that's what bothers me is that, you know, I mean, if I'm talking to people and asking them, you know, for their feedback, you know what I mean? And if I'm getting feedback that says it's okay, then it's okay. You know what I mean? It's like I'm asking like permission. You know, am I pushing on you too hard? Is it hurting? You know what I mean? And I'm adjusting. You know what I mean? And so that's the concern that I have is like, you know. So this is just it hurts me to think that I'm not that by talking to my patients and trying to interact with my patients that I'm saying one thing and they're telling me something, but they're afraid to tell me the truth. You know what I mean? And that's hard, okay? That they're afraid to tell me the truth. It's like, well, what's, you know, like, just give me the feedback, you know, and I adjust. You know what I mean? That's the whole thing is getting that adjustment. You know what I mean? That's what hurts. You know what I mean? It's like, because it's like blindsiding someone. You know what I mean? It's like if you're doing this and you're doing it for good to help someone and they're giving you the positive feedback that you're helping them, how do I know I'm hurting them if I'm getting the positive feedback that I'm helping them? You know what I mean? And they're telling me that. You know what I mean? Like you said, she said, yes, it feels better, but she then wasn't feeling better. You know what I mean? So how do I know that? You know what I mean? Like, unless, so if you...
I think emotional pain, though, is different. And I think you keep talking about helping the physical pain, the cause that brought her there.
Right.
But emotionally, she's not getting help from this. She may be getting some physical because you are doing, in part, the treatment. Her pain is somewhere else.
Well, yes, I mean, if she thought that I was being inappropriate, I could see how that would be painful. You know what I mean? And I don't want that. You know what I mean? That's why I'm trying to be. You know, you can explain something and then go ahead and treat it. But if you're actually talking to them while you're doing it, it's better than, in my mind, than saying, you know, because I'm trying to get real-time feedback, not here's what I'm going to do, then I go do something different. If I'm actually touching the patient and asking for feedback while I'm touching the patient too, you know what I mean? That allows for, in my mind, more, you know, like feedback. Then here's all the information, then you stop the information and you go do it, and then you don't get any feedback.
So if a patient stopped you and said, this feels inappropriate.
Yes, then of course I would adjust. I'd say I apologize and I'd try and explain more. Okay? You know, this is what I'm doing, this is the reason why, you know what I mean, that I'm doing what I'm doing. Okay? So you're gonna adjust and explain. You know what I mean? So yeah, if anyone says that it hurts or, you know, I feel uncomfortable, you know, then I say, okay, let's try a different way. You know what I mean? Let's do this and I'll explain this, you know, to them. So, you know, I've done a lot of work with, you know, like I'm trying to also, like, if If there was patients that I think needed more, I use a pelvic floor therapist. It's like if they need that type of help, I have a pelvic floor therapist that I'll send patients to. There was one patient who came up from that has, and she had this problem with her. This was just in the past few months, and it's like, you're a peer, aren't you? Because gymnasts pee a lot. They have weak pelvic floor. And so we're always working like, okay, you got to learn how to use your pelvic floor to squeeze to help with the core. It's like the floor to the core. But anyways, so I was like, you have no tone down here. Are you a peer? And she goes, yes. And so I had her go to a therapist and get intravaginal and intrarectal work, the pelvic floor, intravaginal, not intrarectal, but intravaginal work, and her spasms, her calmness went away, it like changed, again, it made a big difference for her, but that's when I use other therapists to help with that, okay, because that can make a difference, okay, but that's when I use those pelvic floor, the physical therapists that have training in pelvic floor work,
So do you stay in contact with a lot of your patients after treatment?
A lot of my patients, yeah, over the years, because they'll come back, I'll see them again, and for a different injury, or, yeah.
Do you initiate a lot of the contact with them?
No, I never initiate, they initiate the contact.
I don't really have any other questions right now.
Okay.
What's the best number to call you if I need to?
Let me give you my cell.
And if I want you to call. Okay. And that's my information. Like I said, I think that the Dean will probably want to speak with you soon.
Right.
Not something I can control.
Right.
But I may have more questions from you, and then I'll get a hold of you, so I don't have to call your home or your work.
Okay. All right. Well, thank you. I don't know what else to say, but I'm not trying to hurt anyone, and I must obviously not be doing a good job of explaining things, and I really feel like I'm trying to real time explain things, and it's obviously must not have worked. So, but that's the best I can say, is that I'm trying to get real time, and if I'm offending someone, I would expect that as I'm treating someone, they would say that hurts or that makes me feel uncomfortable. And then you adjust and say, okay, I'm sorry, let me explain it to you, and you adjust. But if they give you positive feedback, then you think you're doing something that's helpful. But so, all right, well, thank you. Sorry.
This complaint kicked off a much larger investigation. Investigators pulled records and digital evidence, and in September 2016, MSU Police escalated to search warrants. A SEPT 2016 search of Nassar's home turned up child sexual abuse material, which changed the entire trajectory of the case. After the second interview, police didn't just take his word for it. They started verifying everything: records, witnesses, what the techniques were supposed to be, and what victims said actually happened. MSU pulled him from patients, then fired him. Search warrants followed, and the case split into two lanes: a state prosecution and a federal investigation that added serious digital evidence charges. By mid-2017, a judge bound the state case over for trial. In the courtroom, everything suddenly spiraled. From the audience, one of the victim's fathers snapped and rushed toward Larry Nassar, trying to take justice into his own hands.
Opportunity to say.
I would ask you to, as part of this sentencing, to grant me 5 minutes in a locked room with this demon. Would you do that?
That is not how
yes or no?
No, sir, I can't.
Would you give me 1 minute?
You know that I can't do that. That's not how our legal system
works. Well, I'm going to
It took 4 officers to pull him back. He fought against them, driven by pure anger and grief. until security finally got control and escorted him out of the courtroom.
No one can behave like this. I want to make sure it's crystal clear. Make sure Judge
You haven't lived through it, lady.
You cannot behave like this. This is letting him have this power over us, okay? She will come out and tell you this. I don't want to see another parent get arrested or put handcuffs on or a victim. We cannot behave like this. I understand Mr. Margrave's frustration, but you cannot.
The legal fallout for Nassar was massive. On December 7, 2017, he was sentenced to 60 years in federal prison after pleading guilty on July 11, 2017 to child pornography charges and evidence tampering. Then the state sentences came one after another. On January 24, 2018, he received 40 to 175 years in Michigan prison after pleading guilty to 7 counts of sexual assault in Ingham County. On February 5, 2018, he was sentenced again, 40 to 125 years, after pleading guilty to 3 more counts in Eaton County. Those sentences reflected the scale of the harm and the number of victims. The case also forced a harsh spotlight onto how institutions like USA Gymnastics failed to protect young athletes, and why stronger safeguards and accountability were needed going forward.